Hello everybody, this is Dr. Saikiran. I'm a medical physician here at People Tree Hospitals, Yashwantpur. World Malaria Day. So I would like to talk about a few points about malaria. So malaria is a disease which is very empiric in certain countries, including Southeast Asia, India, South America, and mainly Africa. So malaria is a disease caused by a parasite called Plasmodium. It has 4 variants, and it is basically spread by female Anopheles mosquito. The mosquito, when it bites an individual, usually after sunset and until morning times, it tries to feed, and at that time basically it inserts the Plasmodium into the bloodstream of the affected individual. So this is how it spreads, and basically we have to prevent mosquitoes from biting human beings for prevention and control. When it comes to clinical manifestations, what are the problems that it can cause by when we get malaria? So what are the symptoms? So basically you can have a subclinical infection, or you can have a very mild kind of symptoms. At the same time, you can have a very serious form of malaria infection as well if it is undiagnosed and not treated. So patients can actually have severe malaria, and it can cause severe anemia, it can cause cerebral malaria and acute kidney injury, and even death in certain situations. And that is why it is important for us to identify the malaria and then treat appropriately. The symptoms that we should look for is basically patients can have severe fever, especially associated with chills and rigor, meaning severe shaking associated with the fever, and patients can have high temperatures even up to 102, 103, 104 as well, and associated with severe fatigue and weakness, and patients can have headache as well. Also at this point I would like to tell that infants, young children, pregnant women, and immunocompromised individuals like HIV/AIDS people or poor nutritional status and elderly people are at risk of having severe infections or severe form of malaria. So how do we prevent malaria? So basically we have to prevent the man-vector contact, meaning we have to prevent the mosquito bites. So what all can we do to prevent mosquito bites at home? So we can use mosquito nets, or we can use mosquito screens at our window, on our windows, and we can keep our environment clean, and we can wear full clothing which will cover most of our arms and our legs as well. Also we have insecticide sprays that we can use inside the house. Also we can use diffusers which can have some insecticides, and mosquito coils or other things that we can use to reduce the mosquito burden or mosquito bite, prevent mosquito bites. So basically we should actually prevent stagnant water anywhere around our house and our community. So if there are tires lying around, or if there is pots available which are just lying around, or there are empty covers and stuff like that, so we need to make sure there is no stagnant water, and empty all these things or put it for trash. So regularly when we put our trash outside every day, we have to make sure it is cleared every day, and educating the neighbors and educating the civic society about cleanliness and trash removal are all the other things that we can try to do at the environment level to prevent malaria as well. How do we treat malaria? So malaria is is a disorder when we identify. So we can give medications, also we can give IV medications and supportive treatment if necessary for the right patient. So if the patient is having mild symptoms, he can be treated as an outpatient. If the patient is sick, then we admit them to the hospital and giving them IV medications and all the supportive treatment. So you need to go be vigilant, and you need to go visit the doctor if at all you think about high fevers and chills, etc. And especially when you're traveling to endemic areas, we give certain medications to prevent infections. So that is also possible. So whenever you're traveling, so you visit your doctor asking about malaria prophylaxis.